listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, we are talking about the costs that factor into your client's out-of-pocket exposure, a very important component of every Medicare coverage conversation. Here are the Medicare out-of-pocket expenses that cost beneficiaries the most, written by Roxanne Anderson. Do you know what your Medicare clients likely spend the most money on out of pocket? Do your clients know what out-of-pocket costs they can expect with Medicare? The stats are in. And just a note, all of the out-of-pocket spending stats in this post come from the KFF report entitled Health Costs Consume a Large Portion of Income for Millions of People with Medicare. That was published on August 21st, 2025. And while the data in the report is from 2022, it's also the most current comprehensive study on this subject. Now, you might be wondering, what contributes to Medicare out-of-pocket spending? First and foremost, let's talk about healthcare costs. In 2022, traditional Medicare beneficiaries spent an average of $6,330 out of pocket on healthcare costs. These service costs accounted for 39% of beneficiaries' annual Social Security income. Now, let's look closer at the factors that may affect your client's bills. Beneficiaries' Medicare out-of-pocket spending varied considerably based on several factors, including their age, gender, health status, and if they had supplemental coverage. When it comes to age, beneficiaries age 85 or older spend almost double out-of-pocket what those between 65 to 74 years old spent. Gender affects costs too. Female Medicare beneficiaries spend more out-of-pocket than male Medicare beneficiaries. Health status also factors in. Those in poorer health spent more out-of-pocket than typical Medicare beneficiaries. Some examples here: multiple chronic conditions, going inpatient during a hospital visit, or living at a long-term care facility. And don't forget supplemental coverage. Individuals who do not have supplemental coverage typically incurred higher out-of-pocket costs than those who had some type of extra coverage. As you've just heard, many factors affect the overall out-of-pocket cost. But there are a few other levers that offer additional ways to limit Medicare out-of-pocket expenses. Helping your clients keep their Medicare out-of-pocket costs low can really help you earn their trust and loyalty. We've got some strategies to limit your clients' expenses by targeting specific factors in the coverage equation. We'll start out with the obvious at number 1, Medicare premiums and deductibles. Make sure your clients are comfortable with the premiums and deductibles they're paying. If your clients go with traditional Medicare, their premiums and deductibles for Medicare Parts A and B are pretty much set in stone. However, you can help them secure enrollment in a Part D plan with a low premium and deductible. Prescription drug coverage is sold by private insurers, so these plans' premiums and deductibles differ from carrier to carrier and plan to plan. What if your client wants Medicare Advantage coverage? There are Medicare Advantage plans with premiums as well as plans with $0 premiums. And regardless of what the MA plan premium is, it's important to remember that a beneficiary will still incur costs to utilize their MA plan. Whatever the premium cost happens to be, high, mid, low, or a $0 premium, an MA beneficiary will still be subject to cost sharing. Deductibles also vary from carrier to carrier and plan to plan, so it's important for you to research these as well. I would point your clients toward using Plan Enroll, where they can compare costs and coverage options in their area. Number 2, in-network versus out-of-network. Another way you can help your clients minimize their Medicare out-of-pocket spending is by ensuring they're in plans that have their desired doctors, hospitals, pharmacies, and durable medical equipment providers in-network versus out-of-network. Plan members tend to pay less out-of-pocket when they visit in-network providers and pharmacies versus out-of-network ones. Number 3, prescription drug formularies. Every prescription drug plan and Medicare Advantage prescription drug plan must have a formulary. A formulary tells everyone what drugs the plan covers and how much they will cost a plan member. Remember to ask your clients about the prescriptions they take and do your research to see which plans make them the most affordable while also making the most sense in regard to the other factors we've mentioned. Number 4, supplemental coverage. Sometimes you have to spend a little more upfront to spend a little less later. There are several types of supplemental plans that can help limit your clients' out-of-pocket expenses. For example, long-term care insurance can really help to address the number one cause of service-related Medicare out-of-pocket spending. Dental, vision, and hearing plans can also cut back on your Medicare clients' dental, vision, and hearing out-of-pocket expenses. And if your client has traditional Medicare, a Medicare supplement should be considered as well. Depending on the plan letter and benefits, these plans can help cover costs associated with the Part A deductible, the Part B deductible, as well as other coinsurances and co-payments, just to name a few. We will have the link to our MedSup benefit breakdown, and that is a super helpful resource to have at your fingertips when you're doing these detailed comparisons. Research shows that many people enrolled in traditional Medicare spend a significant share of their income on healthcare. While that might not sound overwhelming at first, even setting aside a portion of a fixed budget for medical costs can be a real strain. And we all know that over time, small expenses add up quickly. That's why informed guidance is one of the best things you can give your clients. If you're looking to simplify how you navigate coverage options, compare plans, and help your clients make confident, cost-effective decisions, the team here at Ritter Insurance Marketing, the FMO that powers this podcast, would love to help. You can reach out to us with the link in our episode notes. Super easy to do that. You can also use the link that's there to register with our site and take a look at the tools and resources we offer our agents. Thanks so much for listening to this installment of our Agent Survival Guide podcast. If you like what you heard in this episode, let us know. We'd love to have your feedback, and you can email the show at asgpodcast@ritterim.com. That's asgpodcast@ritterim.com. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Roxanne Anderson. Recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Send in your questions to asgpodcast@ritterim.com.